You're listening to Community Insight, a show about the family well-being movement. I'm your host, Valerie Frost. Before we get started, I want to acknowledge our sponsor and my employer, Sunlight. Sunlight is on a mission to strengthen America's social safety net, starting with our child welfare system. Sunlight modernizes child welfare, legal, and health systems through a unified platform with tools that improve communication, legal representation, and health outcomes for youth and families. If you're interested in learning more, the link is in the show notes. This season, we're talking with leaders who aren't just critiquing systems from the outside, but making difficult decisions inside them. Today's guest is Mollie Warren, Director of the Boulder County Child Welfare Agency in Colorado. I wanted to speak with Mollie because she's doing something that makes many people uneasy, leading change from within the child welfare system with the explicit goal of reducing unnecessary system involvement, particularly removals, while still prioritizing child safety. She puts her money where her mouth is, and in that way, she's different from other agency leads. So let's get right to my conversation with Mollie Warren. So Mollie, when we talked before, you said something that I don't hear agency leaders say out loud, that when your agency is involved, you want to be in and out as fast as possible, that you're not fun for families. So what does this actually mean operationally? Like, what do you think your agency should do?
It's a great question. Um, we've been doing some interviews for a manager position recently, and so we've been thinking a lot about just our role and leadership in our agency. And one of the supervisors who's a part of one of the interview panels said something recently that I thought was so brilliant and pithy that just really underlines or seems to represent for me, like foundationally, how we're thinking about this, which is that we don't get involved with the family's life. And even more specifically, we don't create a family separation or removal because it helps us sleep better at night. That we recognize that risk is inherent in all families, and that we weigh the decision to be involved in a family's life first, to stay involved in a family's life second, and to do, what is our most harmful and most severe intervention, which is, what we would call removal or placement or family separation, only when it's absolutely necessary, and that we are really working to hold ourselves accountable to treating the decision to get a child home, if we have created family separation, with the same urgency that happens at the moment of crisis when a decision is made to place a child. And so it is that, I think, for us. It is just being so thoughtful and aware, cognizant of the harm that we create by being involved in a family's life at whatever level of intervention, and moving to the lowest level of intervention as safely possible, as quickly as possible, because we recognize that abuse and neglect happens, and our mandate is to ensure that we're mitigating danger at all times, and at the same time holding true that intervention creates harm as well. And so if we're really truly trying to mitigate harm to a family and to a child, minimizing our intervention to only what is safely possible is the most responsible and least harmful thing we can do.
So put this in just really plain language. Like, what would you do more of and what would you do less of?
I think it's holding that duality just really intentionally. So when we have to make a decision about if we're going to get involved with a family, recognizing that and using a lens in that decision making, that we will create harm and fear and trauma just by knocking on the front door and including that in our decision making. And so recognizing when the alleged abuse or neglect is severe enough that that harm is necessary, that harm being our intervention is necessary versus when what's actually needed is just resources or community support as opposed to, government intervention in a family's life. So the more is more opportunity and ability to just connect families with supports outside of the system and less system intervention for a vast majority of families who, are experiencing a crisis or are experiencing a resource need as opposed to, you know, the more severe kind of continuum of abuse or neglect.
I want to say one of the words that you said stood out to me, the
Mm.
duality.
Mm-hmm.
So, with this mindset, with this approach, what's the trade off that you're accepting?
Mm. There are many, right? To approach the work this way requires trust in our staff um, and our families. It requires discomfort. Risk tolerance is, um, I often refer to it as a muscle of sorts, and so we have to recognize that we have to make a hard decision either way, and either decision is going to be hard. It's just what kind of hard we choose. But the trade-off is discomfort, risk tolerance, um, and I think making decisions that sometimes stakeholders or the system more broadly either doesn't agree with or feels uncomfortable with or feels scared by. Um, but it goes back to what that supervisor said. It is the decision can't be about how it makes us feel. It has to be about what we what we can responsibly do to minimize system involvement for families because we know that it creates harm.
There are a couple other things I want to come back to here, but when you brought up trust, staff, families, just trust in general, it made me think of, there's a real debate in a lot of places right now. Can a child welfare agency both keep kids safe and support families in the community at the same time? Like, especially when families don't trust, like you say, they don't trust the same agency that removes their children. So, where do you land on that and why?
Yeah, I think that the child welfare system, the child welfare agency, should stay laser focused on the mandate of keeping kids safe and should support the community in being who is responsible, being the group or the organization, the people responsible for wrapping around a family or providing resources for a family or support for a family, because our intervention, our agency comes inherently with a power imbalance. And even when we show up and say we're here to help, I think it's safe to say that we don't believe or we're grappling with the fact that we're not meant to be who helps families with resource needs or support needs. Um, and frankly, families don't want us to be who help them with those things. And totally understandably, like, who would want help and relationship with an agency that can create family separation at any moment? And so I think to truly allow our families to get support from people that they can build meaningful trust with when we're talking about families that need resources, families that need support, I think that has to be the community, because the power imbalance, the power differential between the agency and a family is such that building trust between those two is just implicitly harder, as it should be.
So, if this is the reality, why shouldn't the money just move out to community organizations instead?
I guess I believe that it should. Um, that there is more than enough work to go around in terms of supporting families, and I think communities should be better resourced to do that work, um, and we should. I think I think that the infrastructure, the financial infrastructure, hasn't caught up yet, perhaps, to thinking about it this way. Um, and I think, and so, operating in the current iteration of what the system looks like, I think doing everything we can to push financial resources to the community from the child welfare agency with what I envision always as like this giant brick wall between them, is the best we can do today. But I guess I get curious. What if communities were resourced the way child welfare agencies are to support families and could interact with and build trust and relationship with families totally outside of the child welfare system because we had the resources to make that happen more quickly, more nimbly, and more easily.
You brought up earlier like some systems there's disagreement, there's fear, because you're making a case right now. You have a point, but what's the strongest argument against your position?
I mean, I think that kids could be harmed or hurt, or that that families wouldn't get the resources or the support that they need. Um, and we don't make our best decisions when fear is the driving motivator. And so trying to name that and hold ourselves accountable to that, but also recognizing that the child welfare system and family serving systems are bureaucracies, and so we move at the speed of bureaucracy, right? Like we exist, government agencies and bureaucracy exist to maintain the status quo and to create stability, and um, so so moving that needle, making change in how we think about approaching it across everyone in the system, um, is slow and allows, I think, if we aren't relentless and urgent in our pursuit of thinking about this work differently, makes continuing to do things the way we always have feel easier and more comfortable.
I'm wondering what you would say to, because I know with some state agencies, I know every state is different, whether they're county led or state led, all of these things. But state agencies do have, they administer public assistance.
Sure.
Medicaid, SNAP, WIC, all of those things. So when how do you negotiate that if
Mm.
you're kind of filtering support out? Where would they go for Medicaid and SNAP and all of that?
Yeah, it's a really good question, and I'll be honest, I don't know that I have a great answer. I am curious, I guess, about the experience of going to the same building for SNAP benefits that you would also have to go to for child welfare involvement and what that experience might be like. And I I do think that there is a role for government agencies in providing those benefits. Um, and so I think it's a matter of the how as opposed to the what, perhaps. So what if you could, for example, as someone in need of SNAP benefits, go to a family resource center and interact with a benefits enrollment, technician there, that would be a really different experience than doing it in, in our building, for example. And they are, I guess I think of them, they're all human services agencies, I suppose, but I think of the work that the benefits side of our house does differently than I do the child welfare side. And so I guess you've got me curious and thinking about something that I haven't thought about before, which is what is the role more broadly of government in supporting families, uh, and what is the family's experience in accessing those services, even separate from child welfare involvement.
Well, I'm just wondering, like, what would your staff say, or any staff, if they're in a position and they're in the same building as child welfare, but they are there to administer public assistance? How would they feel if they thought, well, I'm not really supposed to be involved with this family that much? I'm uninviting to them. I have too
Mm,
much power. How can they stay humble and also do a good job with that mentality?
mm. Well, I think first, I think the folks I know that work within our like broader human services agency care deeply about families and about the experience of our community. And so I think, my first reaction or response is that they would be excited and open to hearing about folks' experience and thinking about how we could be innovative um, in providing the best experience possible. Folks don't get into human services work to harm people or to make a whole bunch of money, because that's also not a reality, right? And so, these are people who do this work really intentionally because they do care deeply about their community and about the work that we do. And I have not thought deeply, to be honest, about kind of the broader human services organization, and what that experience is like. So you've got my wheels turning a lot, and it's a really interesting thing to think through. Um, but what I know for sure is that the potential of family separation doesn't exist in the same way in an interaction between a family and a benefits technician as it does a family and a child welfare social caseworker. And I think that that's important just to name explicitly. Um, and as leader of the child welfare side of our house, to be extremely cognizant of and centering.
So, organizational structure, you know divisions of broader human services and child protection. Do you think families know when they walk in the
Mm,
building?
it's a great question. I think one of the things I always say is that when we share a business card and it says Boulder County Human Services on it, um, you know, I don't know that folks are always paying attention to like the subline of Family and Children Services, right, which would indicate that it's a social caseworker or like child welfare related um, staff person. Um, and I would like to believe that it does feel different or it's experienced differently if it's like a benefits technician or someone there to help you get signed up for CCAP, right, for child care assistance, or for TANF, or whatever the assistance may be. And I think for me, where the what I have been focused on thus far is the gray area of that human services business card not being the child welfare agency, not being the benefits agency, but being like a more kind of a third option, which is like a supportive service of some kind that's not benefits related, that's not child welfare related, but is intended to help, um, and how that help might feel very different if it's given to you by someone with a Boulder County Human Services business card compared to if it's accessed through your community, a family resource center, a nonprofit, something like that. And so we have had a lot of conversations about, I think, what is kind of traditionally called like prevention work, separate from benefits and separate from child welfare, but intended to support a family from becoming involved in child welfare, and where that should live, and who is best poised to provide that kind of support.
Molly, I appreciate you inviting like broader dialogue to answer some of these questions. I do want to go a little deeper with you though, because you have had some shifts in perspective and some inner transformation that you've gone through. And it sounds like you've had to unlearn some of the default instincts of the
Mm,
job. So, what experiences inside the system forced you to change your mind?
mm. It's a great question. It's funny. So we've been doing. I'm lucky enough to sit on a group called the Reimagining Steering Committee in Colorado, and it's a group tasked with kind of creating innovative change in child welfare, and reimagining what child welfare could look like in the state. And it's a really special group because it in its charter and its bylaws requires that the group be made up of at least 51% of folks with lived experience in the system, whether as children or as parents themselves. And so that group has been we've been doing some like kind of meet and greet conversations, and we're doing some like this or that kind of like would you rather's, and someone brought up a fantastic question, which was essentially, would you rather shrink the front door of the child welfare system or change what's behind the door? And it invited such incredible dialogue. Um, and I think what it helped me realize, well, I learned a tremendous amount, even just from those like short conversations about this one question, but it helped me realize that for a long time, it helped me articulate that for a long time, I believed that the best way to create equity and to advocate for families was to change what was behind the door. And I still believe that we have to change what's behind the door, to be clear. Um, but my journey has been coming to understand that the best way to mitigate harm to families is to also shrink the front door. And so my work is now focused on both of those things. But I would argue or reflect that narrowing the front door is as, if not more important than changing what's behind the door. Because if you never have to go through the door at all, then it doesn't matter what's behind the door for you. You won't experience the harm that could exist there. And so I think when we look at the community as a whole and mitigating harm, ensuring that we're only engaging or intervening with families um, that we absolutely have to, because the allegation of abuse or neglect is so severe that it outweighs the harm created by the system intervention is really important. And what I heard from a couple of folks in that conversation with lived experience very, very clearly was, after you've walked through that door in whatever way, as a child, as a parent, the fear that exists in having to do that again, and the impact that being forced through that door again has on you and your family is with them, exists for the rest of your life, and colors and impacts decisions that may seem totally unrelated in how they parent or approach even things like resources or extracurriculars for their kids, um, because the experience has been so harmful and so scary that it never leaves, essentially. I think hearing things like that from people who have experienced this is incredibly impactful. Um, And I think I have to just also name um, that folks in the system also experience moral injury every day. There are decisions made that we don't agree with or that we don't believe are right, and and I have certainly experienced that myself, um, and have to grapple with and own the harm that my involvement in the system has made me complicit in, essentially.
So, what do you still catch yourself doing that you're trying to undo?
Mm. Uh, Moving too fast and not. I We make incredibly hard and life altering decisions all day, every day. And in the role that I'm in today, when those decisions involve me, it's usually because they are particularly complicated or complex or controversial. And I think it's easy to move into just kind of like a rote place of making these decisions without slowing down to recognize the humanity that exists in all aspects of the people involved, that there are true people involved and that these are life altering decisions, and not centering those things in the decision, and slowing down to acknowledge and recognize that these decisions are incredibly impactful. Um, so I think that's one, big thing is just allowing ourselves the time and space to give the decisions that we are mandated to make the time and space that they need and deserve. Um, and I think being comfortable, being uncomfortable, and really holding myself accountable to that is also incredibly important. Like I said, we move in these government systems at the speed of bureaucracy. And so that means that if we are trying to do something differently, we are taking on risk, and we are going to inevitably make decisions that other people disagree with. And really smart, thoughtful, caring people, to be clear, right? Like, I genuinely believe that there aren't, bad guys in this, but that when really smart people come together and think about really complicated situations and decisions, there's going to be disagreement, and recognizing my responsibility and our responsibility and advocating for what's best for families, even when that is uncomfortable or forces us to take a stand that creates friction or disagreement in relationships with other folks involved in the system. Um, and I think for me in particular, as the leader of the agency, um, I think recognizing that I have to let go of any hope for consensus or popularity or likability, and be willing to step into a place that may require my owning or holding the harm and the pain that comes from relationship disruption or disagreement with folks that we really like and respect and work with every day.
One of the words you said that jumped out at me early on was the controversial. You said that
Mm,
in your response, so I'm going to jump there because I want to
yes.
let's stir it up a little bit. You talk about bureaucracy moving slow, but you've already seen about a 45% reduction in kids entering care over 5 years. I mean, that's not slow. I mean, that's pretty significant. But a lot of people would hear that and have to ask, like, how do you know that harm didn't disappear?
Harm for the kids that we didn't place essentially that maybe we would have 4 or 5 years ago.
Well, maybe like you're missing kids who are falling through the
Mm,
cracks.
yeah.
What would you say to that?
I would say, gosh, many things. I would say that every decision that's made in child welfare is made with bounded rationality. This work does not come with a crystal ball. And that what I hope the staff in Boulder County know and believe is that if they make the best decision they can with the information that they have at the time, that we have their back 100%. Um, and that sometimes we don't know everything. We don't know what we don't know. And so whether that's a decision not to remove and place a kid and create family separation, or a decision to do so. All we can do is the best that we can in that moment, and and use all of the best critical thinking and tools and support and resources available to us to make those decisions. um, I think what's just changed for us is that as we make those decisions, we're doing so with a belief, with a very deep-rooted fundamental belief that kids do better when they are able to stay home whenever they can safely do so. Um, and so we are working as hard as we can to make that happen whenever it possibly can. And it is possible that we will get that wrong. And if we do, um, we will come back to the decision making table and adjust accordingly. Um, but I also think that when we look at research and when we look at just, you know, national or Boulder County data, um, a vast majority of what comes to our attention is, you know, what we categorize as neglect. And we know that we know a few things about that, right? We know that neglect and poverty are very frequently conflated by the system, and that poverty is not abuse or neglect, and that it's not harmful in the way that sexual abuse or severe physical abuse is. And so we need to respond differently to that, if we respond at all, than we do to, you know, an allegation of an infant with 7 broken bones. Like those two situations are not the same and should not be treated the same. And and it is possible in approaching the work that way that we do get it wrong. But what we also know is that, you know, there have been so many studies, and we know so much more about the impact of the system today than we did. Um, if a child or a youth is experiencing kind of moderate abuse or neglect, so let's say 2 kids, same level of abuse and neglect. Obviously, no family is the same, so no situation is exactly the same, but you know, similar level of abuse and neglect, and we follow those 2 kids throughout their lifetime. The child that has no intervention from the system is more likely to fare better in their life than one who does experience system involvement, and especially family separation. And I think that that really matters. If we know that our intervention is not neutral, that has to factor into our decision making, and and it does, or we're sure trying to make sure that it does. And um, and we may sometimes get it wrong.
Well, you say we. I mean, you're not making decisions in a vacuum. Like, what do you do when your own team is split?
So we often utilize I guess you'd call it like a tool called group supervision, where we bring a whole bunch of folks together and we map the entire situation on a board in a framework. The consultation and information sharing framework is what it's called. It's created by Sue Lorbach in Olmsted County way back in the day, and it's been used a lot. But it helps us, that tool helps us, it does a couple of things. It slows the decision making down. It helps us get really, really clear about what the danger is versus what the risk is and what safety exists, right? And we define safety very, very specifically. Safety is actions of protection taken by the caregiver to mitigate that danger demonstrated over time, right? And so defining it that intentionally helps us, I think, understand what is already happening to mitigate the danger and what is not, and what needs to happen, essentially. And so I think just really being clear about exactly what we're worried about, why we're involved, and what needs to happen to ensure that if we're able to articulate danger existing, that it's mitigated is really important, and that tool helps us do that. But it also brings a whole bunch of different folks with a whole bunch of different perspectives and their own unique lived experience, both as professionals and as people, into the conversation. And so it helps to, I think, remove some of the pressure and the fear that comes with owning those decisions, especially like as a social caseworker. If you're able to have that conversation with 7 people and slow down and talk about it at that level of specificity, and then as a group create consensus about what needs to happen next, that just intrinsically diffuses the ownership and the risk on you as a single person making this decision. And I think it allows us to bring more perspectives and voices into the room. One of the things we do in that process is work really hard to have like a cultural broker in the room, for example, to bring a level of cultural humility and to center race and ethnicity and culture in whatever conversation we're having as well. Because we know, right, that Black and Brown families are disproportionately impacted by the system. And so we have to center conversation around decision making with that knowledge as well. And so I think bringing a whole bunch of smart people together, talking about this work really specifically, and ensuring that we're allowing for voices with all sorts of different lived experience is really important.
So, knowing how much power your decisions carry and how hard they are to reverse, like what responsibility comes with holding that seat? And what do you hope that skeptics of your approach would at least understand after hearing you today?
That, just to be really clear, our mandate is to ensure that children in our community are safe in the best way that we're able to. And you know, I would say that ensuring that kids in our community are safe is actually the responsibility of the community as a whole. But that as the agency and the leader of the agency mandated with ensuring child safety, that is our North Star, and that we are always focused on that. We're not doing like child welfare light or something. It's not. It's not a different version of the mandate. We don't have different rules or requirements. I think we're just doing our best to really think about our intervention differently or our involvement really differently. Um, but but at the end of the day, we're working really hard to ensure that kids are safe, and just adding an additional level of awareness to those decisions related to that threshold of of safety in relation to the harm that comes with our intervention. So I hope folks hear that we care deeply about kids being safe and that we're still really committed to that, and that Boulder County, you know, social caseworkers are making decisions to keep kids safe every single day. Um, and I hope folks know that we don't have it all figured out. And I certainly don't. And that we're learning and and growing and paying attention to our data and our outcomes all the time, because I think that they do help us understand our impact. There are a number of kind of outcomes that I track consistently that I kind of refer to as like safety proxies. So when we are involved with the family and we do remove a child and then we reunify them, are they staying reunified, or are we bringing them back into the system really quickly within 6 months or 12 months? Are we seeing an absence of abuse or neglect within a year of our intervention? And and those are things that I pay very close attention to, because we can't do any of this work at the expense of keeping kids in our community safe. And what I would say is, when we look at those kind of safety proxy outcomes right now, they have stayed as good or gotten better in the time that we've made these changes in the last 4 or 5 years. Um, and so and so we hope and believe that we are doing this safely, um, but that we're tracking it all the time, and that we very much understand the responsibility that we hold.
Well, Molly, this conversation wasn't about easy answers or clean solutions. It was about what it means to hold power inside a system where every choice carries risk, intervening too much or not intervening enough. So, your perspective doesn't ask listeners to agree, asks us to sit with an uncomfortable question. Can a government agency charged with protecting children also support families in ways that prevent harm without expanding surveillance, avoiding accountability, or shifting risk out of sight? So, for listeners who are skeptical but curious, takeaway here isn't a promise or a blueprint. It's an invitation to think more honestly about restraint, responsibility, and what it actually takes to step back without walking away. So, thank you so much for this conversation, for thinking this through, for our listeners, for staying in the tension rather than smoothing it over. Thank you for coming on this podcast.
Thanks for having me. I really appreciate it.
That was my conversation with Mollie Warren, director of the Boulder County Child Welfare Agency in Colorado. This conversation wasn't about easy answers or perfect solutions. It was about what it means to hold power responsibly inside a system that can both protect and harm, and to make decisions knowing there are risks whether we act or step back. To learn more about Boulder County's work and the ideas discussed in this episode, check out the links in the show notes. Be sure to follow the podcast for new episodes. You can also rate and review on your favorite platforms and share on social media. Community Insight is produced in partnership with Imagination Factory and 14th Street Studios. Thanks to Matt Anderson, Tavon Lewis, Michael Osborne, and Morgan Honecker. We're funded by the Annie E. Casey Foundation and Sunlight. We thank the Annie E. Casey Foundation for their support and acknowledge that the opinions and conclusions presented in this podcast are those of its hosts and guests alone and do not necessarily reflect the reviews of the foundation.